My name is Sherry Miller. I am a 1997 graduate of Columbus State Community College in Columbus, Ohio, where I obtained my associate's degree in veterinary technology. I grew up in a rural part of Ohio called Coshocton, Ohio. I was intimidated by the veterinary field. I didn't have much experience other than my own animals, and I wanted to obtain a good background in anatomy and physiology and veterinary care of all species. I knew going in that I had an interest in horses, but I wanted to learn a little bit about all species just to give myself a lot of different job opportunities. I had a student externship in Simpsonville, Kentucky at an all equine practice, and as soon as I spent one day there, I knew that's exactly what I wanted to do. I worked for another practice in the Lexington area, and I brought some laboratory samples to Rood Riddle, and I was always in awe of the facility and the reputation and the doctors, and as soon as I had an opportunity, I came for an interview here. I'm responsible for preparing horses for surgery. I work for an orthopedic surgeon, Dr. Larry Bramlage. I've been with him for 18 years. Myself and the team of technicians are responsible for all of the radiographs, the catheters, the preoperative medications, the physical exams, care of the bandages and medications after surgery. On other days, we perform lameness exams. I do a lot of horse handling, aseptic preparation for joint blocks and injections. I do a lot of teaching. I teach young technicians, and I teach a lot of our veterinary interns how to block and radiograph horses. We work with a variety of horses every day, everything from newborn foals to competitive race horses, sometimes retired race horses. Every day is different, every horse is different. It's challenging and exciting. The problems that are presented to us, it just feels really good to help these horses and to get them back to whatever their career might be. Anything we can do to keep them happy and healthy it's very rewarding.
I graduated from college in England back in 2000, came over here on an internship actually to do nutritional research, and ended up falling in love with the veterinary side of the world here in Kentucky. I'm internal medicine technician. I also work with technician training, and I also work with biosecurity for the clinic alongside Dr. Barr for the whole clinic. Main responsibility with medicine is any of our inpatients and then outpatient appointments, but mainly with the inpatients is checking in on them every day, making sure that their comfort levels are taken care of, that their nursing care is gold standard nursing care. I love the neonates, neurologic horses. That's my two loves that I have, and also long-term cases like pleural pneumonias that I get to really utilize all of the nursing care that I've learned over the years from being here. It's not just thoroughbreds. In the last month, we've worked with miniature horses, Friesians, standardbreds. Obviously, thoroughbreds are a large part of it, but there's a lot of warm bloods around here, sports horses. So all of those different breeds, you get to learn their different personalities, their little quirks. They all do have like breed-specific quirks, so you can kind of work with them on that. Diversity of cases, and also the specialty involved in taking care of those cases. It's just a different level than if I was maybe out in the field with ambulatory. My nursing care is like a big asset to these patients. But a lot of our roles is triage, making sure that the patients get assessed the minute they walk in through the door, assisting the clinicians with everything they need. And the big thing with nursing technician-wise is trying to be a step ahead of the doctors and have what they might need next ready. So it's a bit of it's a fun game that I kind of play with myself with that one, is like, how can I have everything ready? And then with the emergencies, a lot of restraint, helping with procedures such as endoscopy, doing a thoracic drain for pneumonia. We'll go ahead and do all of the preparation for that kind of stuff, putting catheters in, managing catheters is a big part of it. A lot of big diverse, and then going on some farm calls as well, especially if we're doing maybe a spinal tap in the field. That would be one of my responsibilities with that too. Loading any patient on the trailer to go home. If we can send them home and get the owners here to pick them up, that's the absolute greatest thing that we can do here. It's a steep learning curve, whichever field you end up going into. Surgery, nursing, internal medicine, it's a lot to learn, but it is so satisfying to send the patient home with, maybe you've managed to get weight on them after they've had an illness, and you take care of their nutrition part of it. So there's a lot of different facets. And I think if you have an interest in a specialty in like one part of it, there's a job for you here that helps advance that and lets you use that. So one of mine is nutrition, and I love it because I can help come up with feeding plans for some of these horses, and It's a steep learning curve, it's a physical job, but it's so rewarding at the end of the day.
I think the best aspect of what I do is coming down a bone scan and doing the scans and seeing the various lesions or fractures or whatever we have pop up, show up. Makes it feel like you actually did something for the day. We're a family. Some days are better than others, but everybody gets along, and it helps make the job that much easier. Everybody helps each other, and like there's another girl who comes out here who can do both scans. There's another girl who goes to an MRI can do that, and we can switch out, and that way we don't get burned out on one thing, and we also get out of surgery, so we can do other things. We're not just stuck in that one little fishbowl. I enjoy MRI because it's similar to bone scan, but also different. Like down here, it's more soft tissue, ligaments, and that type of stuff, whereas bone scan is just the bones. You see different things. The images you get down here are a lot more detailed, because like in bone scan, the best image is still kind of fuzzy. This is like a crystal clear picture.
I call Florida home. I graduated from Eastern Florida State University in Cocoa Beach, Florida, and I came to Kentucky to work with horses. The whole premise of me going to tech school was to work at Rood Riddle eventually, so this was my end goal. I have been here 11 years. I am a surgery scrub tech. That is a combination of a circulating nurse as well as a scrub nurse. So we do everything from prep the horse and roll the horse into the room, as well as assist the surgeon in the room. My advice would be to get as much experience as possible before and during your time at tech school, because the more experience you have, the better prospects you're going to pick up along the way. With your intended animal, whether it be small animal or large animal. Not only am I a fan of the horse, but I'm also a fan of the racehorse. So this is the perfect job for me. So surgery is definitely a team effort. There's not one person in this department that we can go without. So we rely heavily on our anesthesia techs, as well as our surgery techs, as well as our assistants. So everybody has a role and everybody has a part to play.
I love my job. I absolutely love my job. Every day we make babies and we create life, and I don't know any other way to have a better day than that. Just creating life, enjoying what your clients enjoy. I'm so invested in this job that our clients' successes are our successes, their failures are our failures, and I feel that for them and I feel that with them. So it's wonderful to work at a place that everyone in our department feels the same way. We all have the same goal, the same vision, and it's to be successful for our clients and get them what they want. So my job, my role in that is very satisfying and very rewarding, in the fact that when they do well, I feel like we've done well. When they've done poorly, I feel, well, what can we do different? So my job is challenging and exciting, and I love everything about it. As a Theriogenology technician, I am responsible for ordering all of our product in the lab. I handle a lot of the stallion collections, processing, evaluations. We assist in oocyte aspiration and embryo transfers. We have a recipient mare herd that we help manage as well. We stock the vehicles, we keep track of billing. As a technician in this department, our hands are a little bit in everything that we do.
I knew that I wanted to be a veterinary technician throughout high school. I worked as a kennel assistant, and then I went to Michigan State University, where I graduated from their veterinary technology program, and then I came straight to Rood Riddle after graduation. Here I am an anesthesia technician. I am also the veterinary technician externship coordinator. So here I am in charge of monitoring patients and ensuring that they are healthy enough for anesthesia, as well inducing and monitoring them on the table.
All right, my name is William Lellis. I'm from Sickle, Pennsylvania, and I'm Dr. Friend's tech and ambulatory tech here at Rood Riddle. All the other ambulatory clinicians. And then after that, so right now I'm actually studying to take my boards. I just really love veterinary medicine and participating. Making something feel better about it is really a huge part of my job.
So for the veterinary technician externship program, we accept students who are currently enrolled in an AVMA accredited program. It's a great experience for these students to get an off-campus look at what it's like to work in a large animal hospital, as well as see cases that many hospitals don't get to see. This externship program is also a really good way to get your foot in our door if this is something you're interested in working in Rood Riddle.
I am actually from Kentucky. I was born in Lexington but lived in Winchester, and I started working at Rood Riddle the last year of my year of college, and because I thought I wanted to be a veterinarian, and I stayed on at Rood Riddle instead of pursuing that. I started in the nursing staff as a full attendant as a seasonal hire, which we do hire a lot of people for seasonal help. We also hire for year-round as well. And from there, I just kind of stayed on and moved to be over the nursing staff, and then I was given the rest of the technicians to manage. So I hire all of the hands-on horse handling staff with on the technician side, or assistant side. I like people who are looking maybe to pursue a career either in the veterinary world somewhere down the road, whether it's veterinary, being a veterinarian, or just in general want to manage their own farm. But definitely they have to have horse handling experience, and I like people who have had that kind of experience with horses other than just their own horses, so kind of outside of their own horses. And we do a lot of thoroughbreds here, and they can be a little higher maintenance, so anybody that has previous thoroughbred experience is also great. I would say we have a variety of people here. Definitely easygoing is nice. Anybody who's dependable, hard worker, great time management skills, those are kind of the things that make a great assistant here.